York University is going to train new family doctors, and Ontario needs lots of them.
So just relax for me.
2.3 million Ontarians are currently going without, a number the Ontario Medical Association expects to double in the next few years as family doctors retire, reduce patient rosters, or go into other specialties.
For perspective, 6 physicians in Sault Ste. Marie are retiring from Group Health Centre, and that led to 10,000 patients abandoned.
OMA President Dr. Andrew Park says patients without family doctors don't live as long and have a lower quality of life. He welcomes the new medical school, but
we're not going to train our way out of this problem. The greatest capacity to absorb those 2.3 million patients is what exists in the current system.
Meaning getting the family doctors we already have back into the practice, or reducing barriers so they can take on more patients.
I think it will do very little to actually improve the situation.
This family doctor isn't optimistic that a new medical school will solve the problem.
So we have over 5,500 trained family physicians in Ontario right now who are not practicing.
So, what's the problem? Well, many simply don't want to practice family medicine.
It's just really not become a sustainable thing to do to practice comprehensive family practice in Ontario.
That's why Hijazi says he's leaving family medicine, one of many to do so, citing the 20 hours a week spent on unpaid admin tasks instead of seeing patients, and pay that hasn't kept up with inflation.
The compensation that family physicians are receiving has not kept pace with the rising costs of running a business.
Kumanen says compensation for family doctors needs to be competitive with other specialties. Most family physicians are small business owners and have to pay staff and overhead costs with their OHIP funding. Meanwhile, Kumanen says a central referral system would reduce time spent on admin, as would streamlining insurance forms and eliminating the need for patient sick notes for short-term leave.
We know it is possible to turn this crisis around.
These new seats at York University, they represent Ontario's doctors of the future.
Hopefully, ending up where Ontario needs them most. Patrick Swadden, CBC News, Toronto.